screen all the products and supplies needed for application and removal. Next, Kristen will demonstrate the best way to apply and remove your ostomy system. At the end of this demonstration, a resource guide will appear on your screen. This guide contains telephone numbers, mailing addresses, even internet locations of organizations offering support and information to ostomy patients and their families. Kristen will demonstrate the proper technique for applying and removing the ConvaTec ActiveLife one-piece ostomy system. Before handling your ostomy system, always wash your hands with soap and water. To follow our demonstration, you'll need to assemble the following items. Please take a moment to do that now. If you are using a custom-cut ActiveLife pouch, you'll need an ActiveLife one-piece pouch. For reference, this is the tape collar, this is the skin barrier, and of course the pouch itself. Next, you'll need a stoma measuring guide, a tail closure if yours is a drainable pouch, stoma adhesive paste, a pencil, curved scissors, 2 clean washcloths, all care barrier remover, all care barrier wipes, and a mild soap. If you're using a pre-cut ActiveLife pouch, you won't need the measuring guide, pencil, or scissors. Now, carefully remove the system you're wearing. To remove the old adhesive, clean the surrounding skin with an all care adhesive remover towelette. Lift a corner of the skin barrier or tape. Wipe the adhesive remover towelette between the skin and the adhesive. Gently peel the adhesive back while continuing to wipe. Then wash the skin thoroughly with a mild oil-free soap and pat dry. Remember that any oily substance will cause poor adhesion of the wafer. For extra protection against skin irritation, you may use an all care protective barrier wipe. Simply wipe on all care to the surrounding skin, let it dry thoroughly, then apply your ostomy system. If you are using the custom-cut ActiveLife ostomy system, take the stoma measuring guide, place it over your stoma. Measure the widest part of the stoma like this. If you have recently had your surgery, it is important to take stoma measurements each time you apply a new pouch. Remember, your stoma will continue to shrink in size for at least 6 to 8 weeks after surgery. Using the stoma measuring guide, trace the selected size onto the center white release paper of the skin barrier. Make sure the small starter hole is at the center of the circle you're tracing. Complete the tracing. Before custom cutting your stoma opening, separate the front and back panels of the pouch. This helps to avoid cutting through the pouch. Make sure the pouch has a small amount of air inside. Now, take the curved scissors and cut along the circular tracing you have made. Remove the release paper from the skin barrier. For additional security, you can use a small amount of stoma adhesive paste to fill the gaps between the skin barrier and your stoma. Apply a thin ring of stoma adhesive paste to the back of the wafer closest to the opening you've cut. Do not spread the paste. Allow the paste to set for 1 minute prior to the application. For now, do not disturb the release paper on the tape collar. Gently place the ActiveLife pouch in position over the stoma. Maintain gentle pressure on the area closest to the stoma for about 30 seconds to ensure good contact of the barrier with your skin. Now, remove one side of the release paper on the tape collar and smooth the wafer onto your skin. Apply gentle pressure from the center to the outer edges. Avoid wrinkling the tape collar. Do the same to the other side. If you're using an ActiveLife system with the DuraAdhesive skin barrier, over time it will slowly swell around the stoma in what you might call a turtleneck effect. This is completely normal and will not block stool or urine flow in any way. If you have a flush or retracted stoma, you may need to use one of the convex products to increase wearing time and comfort. Please contact your healthcare professional or ConvaTec's Customer Interaction Center to learn more about these options. If you're using a drainable pouch, apply the tail closure. Simply fold the end of the pouch over once. Slide the tail closure over the fold and snap it closed. ActiveLife urostomy pouches feature the AccuSeal tap, which securely closes the pouch while you are wearing it and allows easy draining. Simply twist the swivel valve so that the red dot faces away from your body. This indicates the tap is open, as you can see here. The tap can also be attached to a nighttime drainage system if you wish. If you are using a closed-end pouch, you'll want to use a filter cover when you bathe or swim. Just remember to remove the filter cover afterward. To remove the ActiveLife pouch, gently pull the skin barrier